She looks quite pretty in that shade, so no big deal. Just warn the pizza man before you go out for pizza. So what's up next? Lunchtime facelifts. Yeah, I've heard a lot about these, like mini lifts.
Exactly. So it seems like every time you open the paper or you turn on the TV, there's a latest ad for the newest lunchtime 1-hour facelift, lose 20 years in an hour, and you go back to work. Well, I have a secret for you here. Okay. And the secret that I have is I don't think these lunchtime facelifts work hardly at all.
Really?
Now, most of these facelifts are actually based off a facelift that was described in 1917, and most reputable plastic surgeons have abandoned the procedure a long time ago because it just doesn't work.
What is the procedure?
What it is a small incision that you make around the ear, you pull a little skin back, pull a little muscle back, whip stitches shut, and you're done. And it's basically just a small part of what we typically do with a real facelift. The problem is it's a mini facelift, you get mini results.
Gotcha.
So a lot of the photos that I believe that you see on these ads are a bit misleading. So let's show you pictures of a patient who really had a lunchtime facelift, and let's see how she looks like. These are not pictures that you can see on any ad.
Gotcha.
Okay. And you can see she has some jowls that she didn't like. She has some looseness under her neckline that she didn't like.
Gotcha.
So she went to one of these lunchtime facelift places, had a lunchtime facelift done, and this is how she looked afterwards. So let's take a peek. So as you can see, she still is quite loose under here. She still has the jowls. And believe it or not, she had one lunchtime facelift, was unhappy, went back. They cut her again, and this is after 2.
So and she looks twice as bad.
This is after 2 lunchtime facelifts, yeah. So one of the things, if you're looking at people who are doing lunchtime facelifts, and really plastic surgery in general, is that there are a lot of surgeons doing this that aren't even really plastic surgeons. So how can you tell?
Are you kidding?
Oh yeah, I mean, there are family docs who are performing liposuction. There are ER docs who are doing tummy tucks. There are ophthalmologists doing breast augmentations.
Oh my God.
So what is the secret to knowing that you have a real board-certified plastic surgeon?
I don't know, but you gotta know this.
It is to look for this symbol right here. And this is a symbol of the American Society of Plastic Surgeons. Now, every member of the American Society of Plastic Surgeons is a board-certified plastic surgeon. And on top of that, they're held to a certain high level of ethics, a high level of training, and also continuing medical education. So if your surgeon is not a member of the American Society of Plastic Surgeons, there is a good chance that your surgeon is not an actual board-certified plastic surgeon.
That is huge. That is very important. We're going to make sure we put that up on the website and leave it there for a long time. Yeah. Wow, that's a big one.
Yeah.
Okay, now let's move on to the OR. Tricks that happen in the OR that people might be surprised by. I'm kind of scared to even know this.
No. Whenever we do surgery, there's always one thing. This is the last secret I'm going to tell you, but there's always one thing that we as surgeons can always use if everything goes south. So if I do an operation and the healing is...
you mean?
And the healing is poor, they're having a major complication with blood supply and stuff, we have one thing that we can always turn to if we need to, and it's underneath here. Do you want to see?
Is it going to bite me or do anything weird?
It will not bite you. Now, this is a jar of medical-grade leeches.
I don't want to sit next to Stand By Me.
Now, these are medical-grade leeches, actually.
Are you kidding me?
When we do a surgery,
this is like archaic. This is like medieval. What are you doing with the leeches? You are not putting that sucker on me.
I won't touch you with it. But when we do a plastic surgery, and we are having problems with a body part, like an ear or a finger or even a nipple is not healing right, we always can turn to the trusty leech to actually decrease the bad blood and increase the good blood and can actually save the day. And I have used these before. Not all the time.
You have put leeches on people's nippies.
Yep, I'm going to take one out. So here's a...
Oh, that is so disgusting.
So the name of this is Hirudo medicinal. Oh, reach on the leash.
Oh, my God.
All right, well, this one we'll keep our eye on.
Oh, my God.
I'll put it back here in just a second.
Oh.
But this is actually something we use.
I'm sorry, I didn't hear a word you said.
What they do actually is when we do things like, I had a patient where I replanted the patient's ear actually, and we can a lot of times get a good blood flow into the ear, but if we can't get blood flow out, that becomes a major problem, and it can actually die. And that can happen to other body parts like fingers and, believe it or not, even nipples. So what we do is actually by attaching this slimy blood sucker, it can actually remove the bad blood, allowing the good blood to come in. And usually within a week or so of applying hourly to maybe every 2 hours leech therapy, the blood supply is new and it heals fine, and you're safe.
All of his great tips are going to be up on our website. website, and not that anybody's hungry at this point, the snack of the day. Oh, come on. You're not actually hungry after the, ugh. Oh, well, these will cheer you up. They're hand-dipped peanut butter cups, and they do actually look very yummy, and they're from the Dunmore Candy Kitchen in Dunmore, PA. Thanks for cheering us up, PA. Grab a snack if you can stomach it, and we'll be right back. In a few, our big